Continuing with the next speech, the third one about nanotechnology, tissue engineering, its applicability and perspective in outpatient practices by Antonio Claudio Tedesco from Universidade de São Paulo in Ribeirão Preto. Antonio Claudio Tedesco is a chemist, graduated in photochemistry, has made a doctorate at the medicine school in Boston of Harvard, and photomedicine as well. Between 2004 and 2005, at the University of Paris, he studied in the tissue area and also at the Philosophy and Sciences faculty, developing research in photodynamic therapies and photoengineering of residues. Now he is the coordinator of nanoengineering at Ribeirão Preto. He published more than 140 articles in specialized journals and 360 works in advance papers. Has presented many symposium and conferences, has 3 chapters of books published and 10 technological products. Currently, he coordinates clinical projects in TFD at the Hospital of Ribeirão Preto, chemistry and pharmacy, photobiology, photomedicine. Its professional activities, he interacted with 350 collaborators on scientific works. You have 20 minutes, okay, Professor? Thank you. Good afternoon. I would like to thank you for the invitation and the opportunity to be back in this forum and talk about what we've done in nanotechnology and tissue engineering, and also talk about practical perspectives and outpatient practices, which is the application of nanotechnology in the health sector.
In the working lines where we act, we can detect 3 aspects that are important. The first one is treatment with cancer. It began in 2000. It is in a clinical phase after this date. In 2006, we inaugurated an outpatient in Brasilia and also in Unifesp with São Paulo. And in the end of 2010, we're going to start inaugurating a INPA laboratory together with USP, and there is also the perspective of opening a hospital in Aplicability and Curitiba, and I'm going to try to tell you what is the advantage of using the photodynamical therapy of nanotechnology. We also work with the bioinsecticides area for the treatment of dengue and malaria. And since 2006, we're working with the tissue where we elaborate 3-dimensional skin in labs for the treatment of burnt skin. Why does nanotechnology have such a big impact in the medical area? I think that the biggest impact we see when we try to see the size of viruses and microbes and bacteria. They are much smaller than any molecule in the nanoscale. Professor Zuccolotto and Professor Silva talked a lot about this. When we look at the normal cell, it is easier to put together drugs for the treatment of cancer and other pathologies, and this is the goal of research. So the nanocarriers, we have liposomes of the 70s, the dendrimers, the nanoparticles, nanoemulsions, nanospheres, proteic microparticles, and the composite magnetic nanoparticles. What is important is that they carry a molecule or a drug to a target. So this began focusing on the treatment of cancer. The photodynamic therapy, it involves chemotherapy and photodynamics. In the photodynamic therapy, we use pigments that can be isolated of plants or obtained in the commercial market. We use ionized. We use a luminous activation that will bring out a biological response. Light alone does not work, and also drugs for chemotherapy alone do not work. But the combination of these two agents make free radicals that are when they are produced in the neoplastic cell, and when you lighten up this composite, you remind this cancerous cell that it has to get into apoptose state. And the advantage of this therapeutical proposal is that today it has been developed in a hospital scale. You do not need a surgical intervention. It is available in the hospitals, and the cost of this treatment is very low. I'm talking about 100 reais, 100 to 150 reais for every 3 lesions, and the cost of a lab is in the hospital is about 170 reais throughout in the hospitals. And I'd like to. People ask, why don't we have more of these labs throughout Brazil? I have no answers for that, but in the labs that we have already cured more than 600 patients with an index of cure of 98%. Between intervals of treatment, you can apply again the drug or the light. So it is very effective. It is applied to various types of cancer. The only cancer that cannot be treated with this therapy is the melanoma, because melanoma is already pigmented, and the black color of the melanoma absorbs light, which I use to activate the drug of the chemotherapy. For all other cases, I have success. So which is the kind of light that I use, the rate of light that I use? There are many. Why not? It is below 600 wave, and above 800, I have the water that absorbs infrared, that produces heat, that will produce an effect that will not be controlled. So I limit to the region between 600 and 800, because then I have the control of the destruction of the neoplastic cell. But the ones that are available in the market today, we have the porphyrins. And if you see the structure of these composites, you see that they are big molecules, and that's why we in the nanotechnology so that you can use the administration. So you need a technology of new formulas. And ever since 2000, we work with the UNB group, trying to go ahead and looking for a synergy in the treatment, which comes with the association with the photosensitive drugs with composites, that there are magnetic particles that are in the nanoelectric scale and respond very efficiently to the magnetic field, which is used to for you to place the drug systematically after a biodistribution of this drug that contains a drug that is activated by light and by the magnetic field. I can apply that on the disease. When I apply the magnetic field, I can promote an oscillation of heat. There is an increase of 3 to 5 degrees centigrade that is responsible for the answer of the optoptic response. For big and toxic masses that don't have oxygen with free radicals, I can use the phototherapy. Here we see when you develop a nano capsule, nanoparticle that is quickly recognized by the cell, once incorporated with the application of light or magnetic field, we will develop the death or apoptose of the tissue or cell. There is also a very elegant system that has been developed that are the particles of LDL, the synthetic particles of LDL. Neoplastic cell looks for raw material for construction of membranes and other cellular parts. Lipoprotein is a mixture of everything that a cell needs. So what does a neoplastic cell needs? It increases in its surface the number of receptors of LDL. It can capture LDL from the circulation much quicker than normal cells. So what did we do? We made a synthetic emulsion of the LDL. When administered in a systematic way, it associates with a macroprotein, and it is called LDL-like. Any cell recognizes it as an LDL-like. It phagocytes this cell to obtain the material that it needs. This is the principle of the Trojan horse. Another, what we have also seen in the nanotechnological is the use of these particles that are microprotein particles that has been made together with in the partnership with UNICEF, where we associate in these particles growth factors, that we do it with neuroorthopedia, and to reconstruct the nervous system. So we fulfill this material for people who have suffered injuries, and this permits that these factors create a trail where you can reestablish normal conditions. How these particles are polymeric and biodegradable and biocompatible, they are reabsorbed by the organism, and so the nervous transference is reestablished. What we imagine is if we have success with this, this could be applied more in the future. This is part of the use of nanostructured systems. Another point of development that we have been working with the UNIFESP people, Sylvia has talked about this, are the particles that have to overcome the cephalic barrier. This barrier is very selective. It is the big barrier that does not let some illnesses be treated. What we developed in partnership with UNIFESP is a system, lipoprotein system, different from what Dra. Silva said, that goes through this barrier at the brain. It is which is very selective. It selects by mechanism and not by size. So we're trying to use classic drugs that are used for epilepsy, Parkinson, and Alzheimer, for them to reach the nervous central system. If this is working in the animal model, we can propose this for the treatment of glioma, which is a very aggressive cancer in which today there is hardly any treatment. So the principle, it's the same, or we do it through chemo or through photo light. So we have to use it in association. For Parkinson and Alzheimer, what happens is that if you have an aging cell, and what you use for this are oxidants. So in the case of the therapy that is applied in the case of cancer and eradication of bacteria and viruses, we were to use a combination of drugs and light to destroy the neoplastic cell. When we came back from the work developed in France, we learned how to develop a model of 3D skin. It is built in lab layer over layer through a biopsy of the patient. They reconstruct the derm and the epiderm. Today we can do this in a scaled way. We can produce today 25 to 100 square centimeters of skin, and its lifetime is very limited. The utility of this is for treatment of burnt people. The cost of the normal way of treating this is very high. If we can make this skin in laboratory at a lower cost, it can reach the market. And the idea is to develop the system and also to associate it with what we learned treating cancer and bacteria. How does the photo process can help in this? What we observe in the studies made in France is that the combination of these photosensible drugs and light, they can accelerate 10 to 15 times the scarring process. So instead of killing the neoplastic cell, I'm modulating the response of this tissue that was modulated in the laboratory. It will reintegrate in the transplanted skin in a quicker way. I'm making that the skin that was transplanted that will not be rejected in 30 and 60 days, but it will be reintegrated totally in that lesioned area. In the future, if you have a success to inhibit this process, we can achieve this with other organs as well. And more recently, we have reconstructed vases, blood vases, vessels. And the vessels, when the tumor grows, the vessel becomes starts to become full of pores, And apart from that, through this, the angiogenesis, that the tumor reaches other cells. So what we're using with nanotechnology, we're using anti-angiogenic factors. They are inhibiting the growth of these vessels or drying out these vessels. So then after a while we'll have a necrosed mass that will be surgically removed. And it's another product that has been using nano carriers, being able to reconstruct the vessels and seeing that the chemical drug or photosensitive can reach the site. What is the future of nanotechnology and photoprocesses? It is necessary to make a new design of new drugs and new molecules. There isn't yet a drug that lists to each type of neoplastic condition. It is necessary, and my personal goal is to develop a national network for cancer treatment, skin cancer treatment here in Brazil. My biggest difficulty is being to transform this in a public health policy. And while I don't have it, I do it wherever I can find help. But I don't have an echo in the industrial partnership, because today all the medication that is produced are produced in our center of dynamic technology. I hope that in some months or years, I hope I won't be capable to produce all the demand that will be requested to make this in laboratory. I would like to thank all the people who really work with me, and they are my students who work with me. I also have a national mesh with people who are working in this ever since 1995. And I want to transform this into a public health policy, that nanotechnology, that thought and applied in a correct way, can bring good benefits for society. Thank you very much.